Hi everyone, welcome back to my National Clinical Mental Health Counselor Exam Study Vlog. Today I'm going through another case study and some practice questions. Alright, so this time around we have Jordan Thompson, 27, non-binary, goes by they, them. They are a freelance graphic designer, single, white, and self-referred via a telehealth directory. Jordan reports feeling numb, disconnected, and increasingly unmotivated. They describe a loss of interest in creative work, persistent fatigue, and withdrawing from friends. They state, "I don't feel like myself anymore." Symptoms have worsened over the past 3 months and are affecting their ability to meet freelance deadlines. Jordan expresses difficulty managing emotions and recent changes in identity exploration. They say they came out as non-binary 2 years ago and have lost some family support. They feel a deep grief and existential confusion. They also describe a painful recent breakup with a partner who is dismissive of their identity. Jordan has no previous formal mental health diagnoses, but reports a family history of depression and anxiety. They have been in individual therapy briefly in college following a panic attack, but did not follow through with treatment. They deny any current suicidal ideation or self-harm, but say that sometimes they wonder what the point of anything is. Jordan smokes daily and drinks alcohol socially, so 2 to 3 drinks per week. No other substance use is reported. So as far as the mental status exam, appearance is casual and appropriate, mood is depressed, affect is restricted, the thought process is coherent, the thought content is passive hopelessness, no delusions or hallucinations, insight is moderate, judgment is intact, and they are oriented to person, place, time, and event. This initial diagnosis, and this is still provisional, is F33.1, major depressive disorder, recurrent, moderate. Z60.4, social exclusion and rejection. Z72.0, tobacco and cannabis use, monitoring phase. Which of the following would be most important to assess in the initial sessions? Select all that apply. A, patterns and context of cannabis use. B, Jordan's experience with gender identity and social support. C, history of trauma or adverse childhood experiences. D, any recent changes in appetite, weight, or sleep. E, history of psychotic episodes in the family. F, occupational history prior to freelancing. And the answers are A, B, C, and D. The rationale behind this is assessing substance use, identity distress, trauma, and biological symptoms are all directly relevant. Family history of psychosis, which was E, and job history, F, are less central unless they emerge as relevant later. What would be the most clinically appropriate immediate intervention focus with Jordan? Select one. A, provide psychoeducation on stages of grief. B, explore family systems theory in depth. C, collaboratively identify symptoms of depression and initiate behavioral activation. Or D, refer to an inpatient facility due to passive hopelessness. And the answer is C. The rationale behind this is behavioral activation is an evidence-based intervention for depression. Passive hopelessness alone does not require hospitalization without imminent risk. Psychoeducation and family exploration can be addressed later. Which standardized assessments would be most appropriate to administer in this case? Select all that apply. A, the PHQ-9, the Patient Health Questionnaire for Depression. B, the Audit, Alcohol Use Disorders Identification Test. C, the Gender Identity and Gender Dysphoria Questionnaire. D, Cage Aid Screening Tool. E, the Beck Depression Inventory, BDI-2. And F, the Mood Disorder Questionnaire, MDQ. And the answers are? The correct answers are A, B, C, and D. The rationale behind this: the PHQ-9 is for depression. The Audit and Cage Aid is for substance screening. The Gender Identity Questionnaire is to understand stress related to identity. The MDQ is for bipolar screening, which is not indicated here. The BDI is redundant if the PHQ-9 is used. Jordan mentions that they smoke just to function. What is the best clinical response? Select one. A, suggest that it may be helpful for managing depression. B, ignore this detail unless it becomes problematic. C, normalize their coping mechanism to build rapport. Or D, explore the impact of daily use on mood, cognition, and function. And the answer is D. The rationale behind this is, while rapport is important, substance use may exacerbate depressive symptoms or numb emotions. Exploring its impact supports treatment planning and safety monitoring. Which of the following would be the most appropriate treatment goals for Jordan's plan? Select all that apply. A, increase daily engagement in pleasurable and meaningful activities. B, explore unresolved childhood trauma as a priority. C, develop a personalized relapse prevention plan for substance use. D, strengthen positive identity formation and self-acceptance. E, process the end of their recent relationship in the first session. And the answer is A, C, and D. The rationale behind this is A, C, and D all reflect realistic, stage-appropriate goals. Trauma exploration, which was B, may come later. Processing the breakup, which was E, may be supportive, but not likely the best use of the first session when stabilization is needed. Which referrals or adjunct services would most benefit Jordan at this point in care? Select all that apply. A, an LGBTQ+ affirming peer support group. B, psychiatric consultation for medication evaluation. C, legal consultation for identity documentation updates. D, a nutritionist for weight management. Or E, intensive outpatient substance treatment. A, B, C, D, and E. And the answers are just A and B. The rationale behind this is affirming social support and possible psychiatric medication are appropriate. C could be helpful but is not urgent. D is irrelevant based on the case. And E is not indicated as there is no evidence of functional impairment from substance use requiring intensive treatment. Thank you so much for watching through the end. Please like this video if you found it helpful, and comment to let me know what you want to see next. Don't forget to hit the subscribe button and hit the bell to be notified when I post more content like this, and share with any friends or classmates who might also find it useful. I wish you the best of luck on the National Clinical Mental Health Counselor exam.